I'm Dr. JD McCoy. I am the new chiropractor being hired by King's Daughters Medical Center, and I will be practicing in Wheelersburg. I thought I'd get with you guys today and just kind of explain some things about chiropractic, because I think chiropractic is kind of a misunderstood profession. And so I've put together some frequently asked questions for you guys to kind of listen to, and then maybe I might answer some things that are on your mind. First question that people usually ask me is, what's the normal age of a patient that we see in our office? Well, really, we can see about anybody. I tend to focus mostly on people who are younger kids, maybe around the age of 10, all the way up until, the older patients. I don't really put a cap on the end of it. Anyone before that, I don't do a whole lot of babies or anything like that. I'm not really specialized in that pediatric type of chiropractic. I actually have a specialization in sports medicine. And so I tend to kind of get those athletes that are a little bit younger like that, and then to an older age. Next thing people ask are, what conditions do chiropractic treat? I like to think that chiropractors really treat musculoskeletal injuries and musculoskeletal problems. There's a lot of stuff out there about being able to treat, illnesses and things like that. Those guys, there's chiropractors to focus on that stuff. But here at this practice, we're going to be mostly a nuts and bolts musculoskeletal practice, where we're going to focus on restoring mobility, decreasing muscle spasm, and helping improve pain. Another thing people always ask me is, are adjustments painful? And I hear that a lot, because especially when I'm getting ready to adjust someone, they're like, oh, is this going to hurt? Truth is, they're really not. They actually are very comfortable. Depending on what kind of adjustment that you want, they can be a little bit more comfortable than others. I specialized in a lot of techniques when I was in school, for that simple fact that I know that some adjustments are going to work better for some people than others are. We do instrumentation, we do regular manual adjustments, we do myofascial release. So there's a lot of different ways to get where we want to go. But in the end, adjustments should not hurt, because what they should do is they restore mobility and they help to reduce muscle spasm and decrease the amount of pain. Another thing people always ask is kind of what happens at your first appointment at a chiropractor. So that's, especially people who have never been to one, it's like, oh, what's going to happen when we get there? It's basically just like any other appointment you go to. We're going to come in, our medical assistant is going to do your vitals and do all that kind of stuff like you do when you go see an MD or DO. They're going to take a short history, and they're going to come and talk to me, and they're going to kind of tell me what you guys talked about, really your main problem while you're here. They're going to kind of expand upon that. Now I'm going to come in. We're going to talk a little bit more about that history of present illness, so we can kind of get a little bit more background on it, get a little bit more specific than what the MA did. We'll be doing orthopedic testing, which tests the muscles and bones to kind of see how they're working. Neurological testing, which will test nerves to make sure there's no nerve problems there. We'll do range of motion testing, which is going to test to see kind of how you move. And we'll probably throw some other things in there, just depending on what you're there and, how bad the injury is and how far we want to go into different types of testing. But there's a lot of different things we can do. Number 5, does a patient need a referral to see me? That's a great question that I hear a lot. And the case is that in Ohio, we do not need that. We are a portal of entry, which means that we do not need any type of referrals or anything. You can come off the street and see us. Another thing that people ask is about insurance and chiropractic. That's something that I'm not really sure about. It depends on the person. I usually tell patients that, to be sure, you should really call and talk to your provider to see kind of what they say. Most of the time we find that they do cover chiropractic. It just, depending on people's benefits, it depends on, kind of what your coverage is. And I always recommend that patients talk to their carriers to see what that is. Number 7, what type of education does a chiropractor have? And I get this a lot too, because people are like, are you a real doctor? And they say things like that. And so I think it's kind of good to kind of talk about that. Basically what we do, we go to college for 4 years, just like, MDs and DOs. And then when we get out of school, we go to chiropractic school. Now, our first 2 years are set up didactically, which means that we take classes just like the medical doctors do. In fact, a lot of the teachers that I had actually taught at medical schools and DO schools and things like that. So we get pretty much the same education. The big difference between kind of hours of education is we actually all take right around 4,200 hours of classroom stuff. Is that in chiropractic school, we don't focus as much on medication, since we don't, prescribe. The medical doctors are going to focus a lot more on that. We spend a little bit more time on x-ray. So we kind of make up for it with our x-ray reading versus the prescribing of medication. One of the big questions, and I always say this for the last, because I think this is one that people get kind of freaked out about what's the pop during the adjustment when you hear that. Basically what that is just us restoring motion to the joint. When joints gap, when we provide that mobility back in there to help relax the muscles, that popping is an escaping of gas, which causes just like a little reaction in the body to let that go to restore that mobility. So it doesn't hurt or anything, like I said previously.